Hey guys, welcome back to the channel. Today I want to show you an easy and quick method of using kinesiology tape on the ulnar sided wrist. I use it a lot for my patients for ulnar sided wrist pain, TFCC tears or strain, just people who have a lot of like hypermobility or instability on that side of the wrist. And I especially like it for wrist pain because it's offering flexible support. It offers a little bit of decompression. The idea behind kinesiology tape, right, is that it convolutes the skin or creates little ripples in the skin, which helps to decompress the nociceptors. So it's helping to relieve pain. I've had a lot of really positive feedback, so I don't know how everybody else out there is taping for the ulnar sided wrist pain, but if you have a different method or if this method has worked for you or you have something groundbreaking or something that you use, let me know in the comments, and I'd love to hear from you or see exactly what you guys are doing for taping. I also like this method because patients can actually tape themselves too. It takes a little bit of practice to get the hang of it, but they can definitely do it on their own. So it's really nice for that. You can teach them how to use it, how to apply it, and then they can go on after your therapy or in between your therapy sessions and keep using the tape to kind of promote this pain relief or these results that you got them in therapy. So yeah, that's what we're gonna do today. Okay, so we'll get started. All you are going to need to do this taping method is a little bit of sports tape, some scissors, and nice clean skin. So make sure that there's no lotion, sunscreen, any kind of oils on the skin. It's gonna help your tape to stick a little bit longer. I always warn my patients before I apply tape, if it starts to itch, irritate their skin, they don't like the way it feels, just go ahead and take it off. If it feels good to you, leave it on as long as possible. You can shower with it, it can get wet. It's really great for sport. I always tell them wait maybe an hour after you apply the tape before you get it wet or you get really sweaty. It'll help it last a little bit longer. So for this taping method, you're gonna need 2 pieces of tape, okay? And I'm using myself, so I cut enough for my forearm. You could take it a little bit longer if you want. Essentially, you want to go from the pinky side of the wrist, right about, I like to go about halfway up the palm. Some people, you can actually take it up to the pinky, cut a little hole, get fancy with it. But just for a simple, quick application, I take it about midway up the hand, and then I'm coming down to about 2/3 of the forearm. So for me, that's going to be enough, okay? And then your second piece, you want to be enough that it fits all the way around the wrist, okay? So we're back to that longer forearm piece. You're gonna rip one end off that paper, and what I like to do is actually put my patients in a slight ulnar deviation, so it doesn't even need to be this extreme, right? You want to kind of get them to that point where they're able to take a little bit of ulnar deviation. You're going to apply the tape starting here with no stretch. Okay, so again, I'm in this position. I'm just gonna stick this piece right here, get my anchor going, okay, and then I'm going to just go ahead and kind of paint that tape on. Because you're already in a slight tilt position, you don't need to apply any stretch to your tape, okay? And you're just rolling it literally all the way down the forearm until you get to the end, and then you'll go ahead and have them lift the wrist up and then smooth the tape onto them. Use the paper backing to go ahead and adhere the tape a little bit better, right? Okay, so we've got that piece. The next piece, you're actually going to rip in the middle of the paper. This part is a little bit hard to do on yourself because I like to add a little bit of decompression. So I can't talk today. If you want to do this piece with a little bit of stretch in it, it's a little bit hard to get that on yourself. You have to practice a little bit. You can kind of pull the tape back and then get it into a position where you can just really like pull it apart like that and then kind of stick it on the wrist. But essentially we're hitting right here on the ulnar side of the wrist. You can put the most stretch in the position where they're having the most pain. So kind of isolate where the pain is for them. I usually don't want it to come above the line of the hand here, the wrist crease, because then it falls off a lot easier because they're moving their hand all the time. But you'll find what works best for you and for your patients. So you're going to get like your 25 to 50% stretch on that piece just for decompression. You're going to stick that right where you want it. And then the rest of the wrist just literally rolls onto the skin. So no stretch around the rest of it. Okay. And you get that piece on there. You smooth it out. And then that's what it looks like. So I've had a lot of success with my patients with this, but you may have a different way that you prefer to do it. And I'd love to hear about how you guys are taping. Again, this is the way that I've been taping my patients with ulnar wrist pain. I've had a lot of positive feedback. People can move, they can do their work, they can wear their splints, like if they have a daytime soft splint or anything like that, a brace that they're using, they can wear it on top of it. It just gives them a little bit of support. They're able to, you know, wash dishes or do whatever they need to do with it on, and it doesn't interfere with their day. So that's all for today. Thank you guys so much for watching. I hope you enjoyed this video, and feel free to comment below if you have any suggestions or ideas of your own, and stay tuned for the next video. If you liked this video, please subscribe to the channel for more hand therapy content. Thank you guys for watching.